everyone, I'm Dr. Pranjal Jain, and today we are back with another episode of Concising and Compiling Stuff for your NEET PG exam. Today we have lasers, that is, all the different lasers through all your different subjects of MBBS compiled right here. So, if you have laser treatments in ophthalmology, ENT, derma, and surgery. Let's go. In ophthalmology, we need to study three lasers: Nd:YAG, double frequency Nd:YAG, and argon fluoride. Nd:YAG is an important laser which has quite some overlaps. Here we remember the mnemonic SIP or SIP. So we have the SMILE procedure, iridotomy, and posterior capsular opacity. So after cataract basically. So the SIP procedures are treated by Nd:YAG laser. Double frequency Nd:YAG laser. Double frequency means double trouble. So we have double P here and we have trouble here. So double trouble, double frequency Nd:YAG laser used for panretinal photocoagulation as well as trabeculoplasty. We also have argon fluoride, and there is something called as argon green as well. How we remember is argon fluoride has an L in it. So this is used for LASIK, L for LASIK. Argon green is for certain other procedures. For us, the important ones are Nd:YAG SIP, double frequency Nd:YAG, double trouble, and argon fluoride LASIK. Moving to lasers in ENT. This is very simple. In ENT, any condition would have one laser treatment which would be CO2, except two of them, that is the polyps and the epistaxis, which basically means any vascular pathology, if it is there, we use the KTP laser. Otherwise, CO2 for practically everything. May it be vocal cord polyps, Rinke's edema, laryngomalacia, anything. Okay. Dermatology. Here we have the widest use of lasers so far. Let's study. KTP laser we studied right now. It is for any vascular malformation. So here also we will see KTP is for vascular. Okay. Now argon A, B, C, you remember? From A we have actinic keratosis and BC is basal cell carcinoma. CO2 is used for any skin bulges. So either we have warts, moles, we have acne, keloid, anything of that sort, any bulge per se, we use CO2. So let's see these three. Argon, A, B, C, CO2, any kind of bulges, KTP, vascular malformations, Q-switched disc. When you ask, Q God, Q, why am I doing the labor work? Why am I putting bricks on my back? Nevus of Ito. Why back? We see the characteristic hairy lesion on the back. So Q-switched is the question by that labor, nevus of Ito. Pulse dye. Dye is of various colors. So you can remember pulse dye as purple dye. And what condition has a purple colored dyed face? That is Sturge-Weber syndrome. Okay. Moving to surgery. Nd:YAG and holmium YAG. Here, Nd:YAG is used for two big surgeries. What surgeries? Big surgeries, that is bladder cancer and gallbladder stones. Bladder cancer, gallbladder stones. Whereas holmium laser, here we can remember it as two ways. First, holmium is used to create a hole or an opening. So if there is a benign prostatic hypertrophy, the prostate is hypertrophy, we need to create an opening for the urethra. If there is a urethral stricture, again we need to create an opening. Lithotripsy, there is a kidney stone, we need to remove it, we need to make an opening for it to pass. So any hole if we want to create, an opening if we want to create, we use the holmium yag, or the other way is we remember it as holmium yag, lithotripsy, urethral stricture, hypertrophy. Holmium yag for BPH, urethral stricture, lithotripsy. Okay, so that is all in all the important lasers that you need to know for your NEET exam. Let's compile them into a master chart. First off, we have the CO2 laser, which is used for any kind of skin bulge. So either your warts, moles, acne or something, or any bulge in ENT. So your laryngeal polyps, laryngocele, saccule comes out, any oral cancer. So everything in ENT which is bulging out, or anything in skin which bulges out, it uses CO2 laser. KTP laser, as we studied, was for vascular malformations, which also include your polyp and epistaxis. Argon laser, we have two kinds of argon laser. Argon fluoride is L for LASIK, and argon is for actinic keratosis and basal cell carcinoma. Then double frequency ND yag is double trouble. Double was PRP, trouble was trabeculoplasty. है ना? ND yag. Now this is the biggest list. Here we need to remember the mnemonic big SIP or big SIP. The big here also means that ND yag has the biggest or the longest wavelength of 1064 nanometer. Okay. So big SIP stands for bladder cancer, gallbladder stones. SIP of ophthalmology, smile, iridotomy and posterior opacification. The last, holmium yag, that is either to create a hole or holmium, hypertrophy, urethral stricture, lithotripsy. So that is all about lasers that you need to remember. Hope you liked this video. If so, please hit the like button and the subscribe button. Thank you so much.